I got this question on Instagram, and it was an interesting one, and it was, do blue light that is emitted from your cell phones cause aging? So I thought about it from a scientific standpoint. The wavelength of blue light in the sky is anywhere from 380 nanometers to 500, and the wavelength emitted from phones are about 400 to 490, so they're kind of falling in the same wavelengths. We use blue light in dermatology for a couple of things, but one of the things we do use blue light for is to actually build collagen in our skin. We give it to patients that have acne scarring, and it helps build collagen in our skin, and it has an anti-aging effect, actually. If I sort of juxtapose the data that comes from our blue light rays that we use in the office onto the idea that the phone is emitting blue light, I think the reverse would be true, that cell phones might have an anti-aging effect on our face. Who knew? The more you talk, the less old you get. So what do we use blue light in the office for? Blue light is used in the office for two main reasons. It's used for scar repair, usually on acne patients or on other people who have facial scars. And we use it in combination with topical chemotherapy. And then it's also used for hair growth, so we can see that it grows hair. And then the final thing we use it for is to cure skin cancers on the face, actually pre-cancers on the face. We incubate patients with the chemical on their face, and then we have the light sort of activate this chemical, and then the chemical kills all the precancerous cells, and it actually grows new skin. So we use it for blue light in the office for three main things: for acne scarring, we use it for hair growth, and then we use it for pre-cancer treatment. The typical patients that get blue light for acne scarring usually have multiple treatments. I like to do 2 rounds, day 1 and then repeat in 6 weeks. You incubate the patient with a chemical that's a topical chemotherapy. They have different ones, and depending on the one you use, the patient either waits no minutes or they wait an hour. And then after the patient waits and the cream sort of embeds into your skin, they are put under the light. The light activates the cream, and the cream basically induces an enzymatic process that builds more collagen in the area. In terms of blue light used for precancers, it's very similar to the thing I described for acne. The patient gets painted with a topical chemotherapy agent, and depending on the agent, they either wait 0 minutes or an hour. How it works for hair growth is it actually makes the hair papilla replicate, so you develop more hair cells. If you want to learn more about these topics, you can visit our website at cinedern.com and make an appointment with one of our providers, or you can call to make an appointment at 718-491-5800.